my sister nearly lost her life from a morning stroke. My 68-year-old sister, healthy, active, and showing no warning signs, suddenly went quiet, then collapsed right at the kitchen table. We panicked and called for an ambulance. At the hospital, the doctors confirmed it. She had suffered an ischemic stroke. But what shocked us even more was the cause. A small habit she had repeated every single morning for years. Something we all thought was harmless had been silently raising her blood pressure day after day until her body couldn't take it anymore. "You got her here just in time," the doctor said. 15 more minutes, and the brain damage could have been permanent. Since that day, our entire family has changed our morning routines, because no one wants a simple, unnoticed habit to be the reason they never get a second chance. Today, I'm going to share a habit that may seem harmless, but could leave you permanently disabled or even cost you your life. Have you ever woken up, skipped breakfast, grabbed your cup of coffee, and gone about your day thinking all is well, only to feel lightheaded, dizzy, or confused a few hours later? Every year, thousands of people over the age of 60 suffer a stroke, not because of a major accident or long-term illness, but due to a simple habit they repeat every single morning. Are you unknowingly doing something every morning that's silently damaging your brain? In this video, we're diving deep into a common routine that could be raising your stroke risk without you even realizing it. And more importantly, what you can do today to prevent it. The morning habit that increases stroke risk. Let's talk about a habit that seems completely harmless, maybe even comforting, but could be increasing your risk of stroke each day. That habit is drinking coffee on an empty stomach first thing in the morning. Sounds surprising, right? After all, for many of us, morning coffee is a beloved ritual. You wake up, shuffle into the kitchen, pour a hot cup, and sip it in peace. No harm done. Or so it seems. But here's what most people don't realize. Why this habit is risky for seniors. As we age, our bodies react differently to caffeine and changes in blood pressure. Here's what happens when you drink coffee before you eat. Caffeine is a stimulant. It causes your blood vessels to constrict. This can increase your blood pressure, especially if you already have hypertension or a heart condition. Drinking coffee on an empty stomach means the caffeine gets absorbed more quickly. This leads to a sudden spike in both blood pressure and heart rate, which can put extra stress on your arteries and heart. It can also cause mild dehydration, which makes your blood thicker and harder to pump, especially first thing in the morning when you're already slightly dehydrated after sleep. When all of this happens at once, high pressure, fast heart rate, thickened blood, it creates the perfect storm for a stroke to occur. A real-life story to consider. Let's take the case of George, name changed for privacy, a 72-year-old retired engineer. Every morning for decades, George drank 2 cups of black coffee before breakfast. It helped him wake up and gave him a sense of routine. One morning, after finishing his second cup, he stood up to refill it and suddenly collapsed. He was rushed to the emergency room, where doctors told him he'd suffered a mild ischemic stroke. They explained that the combination of dehydration, empty stomach, sudden caffeine intake, and quick standing motion created a dangerous blood pressure surge. Thankfully, George recovered. But his daily habit had to change, and yours might too. Other risky morning habits for stroke. Coffee on an empty stomach isn't the only culprit. Here are a few other habits that might be increasing your stroke risk without you realizing it. Standing up too quickly. After waking, when you jump out of bed suddenly, your blood pressure can drop sharply, a condition known as orthostatic hypotension. This may lead to dizziness, fainting, or even falling, all of which can trigger or worsen a stroke in vulnerable individuals. Better option: sit on the edge of the bed for 1-2 minutes, take deep breaths, and let your blood pressure adjust before standing. Skipping breakfast without food, your blood sugar may drop, especially if you take morning medications. Low blood sugar can lead to confusion, weakness, and increased stress on the brain. Better option, eat a small, healthy breakfast, even just a piece of toast or fruit, before coffee or meds. Taking blood pressure meds. Incorrectly, some seniors take their medications first thing in the morning without food or water. This can cause side effects or make the meds less effective. Better option, follow your doctor's instructions carefully. Some meds work better in the evening or with meals. Cold showers. First thing in the morning. This can shock your system, especially your blood vessels, and raise blood pressure unexpectedly. That's not ideal for seniors with existing cardiovascular concerns. Better option, use lukewarm water and avoid showers immediately after waking up. The morning hours are a high-risk time for stroke. In fact, research shows that more strokes occur between 6 a.m. and 12 p.m. than at any other time of day. This is partly because our bodies go through natural changes in hormone levels and blood pressure when we wake up. Adding stress, like caffeine, sudden movement, or skipping food, can tip the balance toward danger. But the best part? All of these risks are preventable with a few simple changes. How to change the habit safely. The good news is you don't have to give up coffee or your favorite routines to reduce your stroke risk. What matters is how you do things and making small, smart changes to better support your heart, brain, and blood vessels. Let's look at simple, practical steps you can take to protect your health every morning. Eat something before coffee, even. A small amount of food helps cushion the effects of caffeine. Try a slice of whole grain toast, a banana, a few almonds, or some yogurt. The goal isn't a full breakfast, just something in your stomach so the caffeine doesn't hit too hard. Bonus: eating first helps regulate blood sugar and energy levels throughout the morning. Why this? Works. Food slows down caffeine absorption and helps prevent sudden spikes in blood pressure or heart rate. Drink water. First thing, you've just gone 7 to 8 hours without any fluids. Your body is naturally a bit dehydrated when you wake up, and caffeine only worsens that. Make it a habit to drink a full glass of water, room temperature or warm with lemon, as soon as you get up. Hydration supports smoother blood flow, helps digestion, and wakes up your system naturally. Tip: keep a glass of water by your bed so you can sip it right after waking. Rise slowly and steadily. Getting out of bed too quickly can cause a sudden drop in blood pressure, which might make you dizzy or unsteady. Sit up slowly in bed, dangle your feet for 30-60 seconds, then stand carefully. If you feel lightheaded, pause and take a few deep breaths. Why this matters? Sudden movements can increase your risk of falls, which are dangerous on their own, and potentially stroke-triggering if the body is already under stress. Time your medications correctly. Some people take blood pressure or heart meds first thing in the morning, but not all medications work best on an empty stomach. Talk to your doctor or pharmacist about when and how to take each of your medications. Keep a pill organizer or set reminders so you stay consistent. Helpful tip: some blood pressure medications may be more effective and gentler on the system when taken in the evening. 5. Try lower caffeine or herbal options. If regular coffee makes you jittery or increases your heart rate, consider cutting back or trying alternatives. Half-calf blends or decaffeinated coffee still provide flavor with less impact on blood pressure. Herbal teas like rooibos, chamomile, or ginger are caffeine-free and offer calming effects. Green tea has less caffeine than coffee and contains antioxidants that may support heart health. You don't have to eliminate coffee entirely, just adjust your intake to suit your body. Bonus: Add a mindful morning practice. Starting your day calmly can lower stress hormones and benefit your entire cardiovascular system. Try 5 minutes of deep breathing, light stretching, or quiet meditation after waking. Listen to gentle music, sit by a window, or enjoy a mindful moment with your warm drink. Reducing stress is one of the most overlooked ways to protect against stroke and heart disease, and it costs nothing. Early warning signs of stroke. One of the most important things you can do for your health is recognize the early warning signs of a stroke. Acting fast can save your brain and your life. Strokes often don't cause pain, especially in the early moments. That's why many people ignore the signs, assuming they'll pass or blaming them on fatigue, age, or stress. But every minute matters. When brain cells are deprived of oxygen, they begin to die, and that damage is often permanent. Common early signs of a stroke here are the symptoms that may come on suddenly and should never be ignored. Sudden numbness or weakness, especially in the face, arm, or leg, often occurs on one side of the body, e.g., drooping on the left side of the face. 2. Trouble speaking or understanding speech, slurred or confused speech, difficulty finding the right words, inability to understand what others are saying. Vision problems, blurred or blacked out vision in one or both eyes, double vision. 4. Dizziness, loss of balance or coordination, trouble walking, stumbling, or feeling unsteady. Unexplained dizziness that comes on fast. 5. Severe headache, sudden and intense, often described as the worst headache of your life, may be accompanied by vomiting or altered consciousness. Remember the acronym. FAST. This simple memory tool can help you recognize stroke symptoms quickly and take action. F. Face drooping. Ask the person to smile. Is one side of the face drooping? A. Arm weakness. Ask them to raise both arms. Does one drift downward? Speech. Difficulty. Ask them to repeat a simple phrase. Is the speech slurred or strange? T. Time to call emergency services. If you see any of these signs, call emergency help immediately. Time is brain. The faster you act, the more brain function you can preserve. Less obvious but still serious signs in seniors, especially in older adults. Stroke symptoms can sometimes appear more subtle or be confused with other conditions. Sudden confusion or forgetfulness, fatigue or sleepiness. Sudden personality changes or agitation, unexplained falls or dizzy spells. Don't assume it's just aging or a bad day. When in doubt, check the FAST signs and never hesitate to seek help. Why immediate action is critical: the treatments available for stroke, like clot-busting medication, TPA, are most effective if given within the first 3 to 4.5 hours. After symptoms begin, waiting too long may mean losing the chance for full recovery. That's why stroke specialists always say, don't drive yourself. Don't call your doctor. Call emergency services immediately. Help seniors around you. Spot the signs. Talk with your spouse, family, or caregiver about the signs of stroke. Place the FAST acronym on your refrigerator or near your phone. If you live alone, consider a medical alert device that can call for help if you can't. Recognizing the signs and acting fast can be the difference between a full recovery and lifelong disability. Natural ways to prevent stroke. Here's how to build a safer, brain-friendly morning routine. Eat a heart-healthy breakfast. Think oats, berries, whole grain toast, or Greek yogurt. Stretch gently. A few minutes of stretching can wake up the body and improve blood flow. Practice deep breathing or mindfulness. Helps regulate heart rate and lower stress. Hydrate. Seniors often forget to drink water. Start your day with 8-12 ahs. Walk for 10 minutes. A light walk in the morning sun helps circulation and mood. Monitor blood pressure. Keep a log and check it a few times a week. If this video spoke to you or reminded you of a parent, spouse, or friend, please share it. One simple share could save a life. Don't ignore your health. Schedule that checkup. Ask your doctor about your morning routine. Start your day with intention, not risk. You've worked hard all your life. You've earned the right to enjoy these years, to travel, to spend time with grandkids, to sit quietly with a good book and a warm drink. But health doesn't happen by accident. It's the result of tiny choices, made every single day, as poet Mary Oliver once asked, "What is it you plan to do with your one wild and precious life?" Let's make sure that life is long, joyful, and stroke-free. Thank you for watching, and take care of yourself. You're worth it.